Disease didn't disappear because humans got cleaner. It disappeared because cities built systems. Before antibiotics and before many vaccines, cities still fought epidemics. They used rules, infrastructure, and surveillance, and it worked more than people think. Stay with me, because this story isn't heroic doctors. It's boring systems that saved millions. For most of history, cities were dangerous places to live. Density makes everything faster. Trade, ideas, wealth, and disease. When people live close, infections spread efficiently. If you attract workers and merchants, you grow. If you grow, you become vulnerable. And if you do nothing, epidemics become normal. They become part of the calendar. Cities couldn't cure most infections, so they focused on control instead. Contain spread, reduce contact, remove contamination. That was the strategy. The first system was quarantine. Quarantine sounds simple, but it's logistics. You need enforcement, facilities, food supply, and rules. You need a place to hold people. But slowing spread buys time, and time saves cities. Ports were especially important. Ships brought goods, but they also brought pathogens. A port city is connected to the world. That connection is profit and risk. So cities built quarantine stations, islands, coastal hospitals, holding zones for arrivals. Because it reduced uncertainty, and uncertainty is what makes outbreaks explode. It didn't stop every outbreak, but it slowed outbreaks. And slowing can mean the difference between containment and collapse. The second system was surveillance. Cities learned outbreaks leave patterns. Certain streets, certain neighborhoods, certain water sources, disease didn't hit randomly. So they started tracking deaths, symptoms, and locations. Early epidemiology, before germ theory. Records turned panic into strategy. Strategy turned into policy. Once you can map sickness, you can target action. Close a market, clean a street, restrict gatherings. That doesn't require a cure. It requires information. And information requires administration. That's the hidden power of record keeping. A city that measures disease can react faster. A city that guesses reacts too late. That difference matters. Delay turns clusters into crises. For a long time, many cities believed the wrong theory, miasma or bad air. But the actions it pushed were often useful. Cleaning, ventilation, waste removal. Even with the wrong theory, they reduced transmission, sometimes by accident, sometimes by pattern. That's one of history's strangest lessons. Wrong explanations can still produce useful systems. Results mattered, even when theory lagged behind. That leads to the third system, sanitation. Cities noticed filth and disease moved together. So they built drains, managed waste, regulated slaughterhouses, and cleaned streets. They moved cemeteries and controlled dumping. They tried to stop contamination at the source. Sanitation didn't cure disease. It removed the fuel disease feeds on. Sewage was a huge problem. A growing city produces waste faster than nature can absorb. Without systems, waste leaks into streets, wells, courtyards, and rivers. And once waste enters water, disease gains a delivery network. Clean water was the biggest upgrade. Many deadly outbreaks were linked to drinking water. So cities built aqueducts, water mains, filtration, and later treatment. When water improves, disease patterns change. Life expectancy rises, and child deaths drop. Cities stabilize because the background level of sickness falls. Health becomes an economic advantage, not just a moral goal. Cities also control disease by controlling movement. Mobility becomes a health issue. They used health passes, travel restrictions, and checkpoints. Infected areas got sealed. This is public health as border control. It's not always gentle, but it's effective. Officials needed to know who arrived, who left, who fell ill, and where. That required lists, permits, inspections, and local reporting. So health systems expanded bureaucratic power. Epidemics made administration stronger. The fourth system was regulation. Cities regulated markets, milk supply, and waste disposal. They inspected buildings. They required ventilation, spacing, and sometimes closures. They forced compliance. Regulation feels annoying, but it prevents small hazards from scaling. So regulation exists to catch repetition before repetition becomes system-wide failure. This is why city health boards became so important. They coordinated rules across neighborhoods. Without coordination, one clean district is undone by one neglected district. Disease ignores administrative excuses. It moves through the weakest link. Then there's the fifth system, hospitals and isolation wards. Early hospitals weren't modern medical centers. They were management centers. They separated sick from healthy. They concentrated care and made surveillance easier. Even without cures, isolation reduces transmission. That alone can save lives. Hospitals also made disease visible. They turned scattered suffering into organized knowledge. That information fed the wider system. Hospitals were treatment sites, but also data sites. Now add communication. Public health is partly enforcement and partly persuasion. Cities used notices, bells, pamphlets, and later newspapers. They announced closures and restrictions. They told people what to do. They tried to shape behavior, fast. Because systems only work if people cooperate, at least a little. And cooperation is always a struggle. Quarantine hurts business, and restrictions hurt income. So public health systems evolved. They needed better enforcement and better incentives. Because the enemy wasn't just disease, it was human behavior under stress. That is still true now. Panic, denial, fatigue, and distrust can break good systems. A health order on paper means nothing if nobody follows it. So cities learned to mix force with messaging, punishment with explanation. They used religious leaders, local officials, and community pressure to increase compliance. War and trade accelerated everything. When armies move, disease moves. When trade expands, pathogens travel faster, so states invested in public health. Merchants avoid plague zones, investors avoid unstable ports, workers flee unsafe districts. So disease control became statecraft, health became part of national power. Here's the key point. Cities didn't need germ theory to control disease. They needed patterns, enforcement, and infrastructure. They needed systems that reduced exposure. Once they built systems that improved environments, outbreaks became less frequent and less deadly. Then science arrived and explained why it worked. That explanation was revolutionary, but the infrastructure already mattered. Germ theory made public health smarter. It did not make public health appear from nowhere. But the foundation was already there. Observation, records, sanitation, and control. When germ theory and modern medicine developed, they didn't replace these systems. They amplified them. Vaccines help, but sanitation still matters. Antibiotics help, but clean water still matters. Modern health comes from stacked systems, multiple layers, reinforcing each other. That's why it's so resilient, until one layer fails. If sewers fail, disease returns. If trust fails, compliance drops. If surveillance fails, outbreaks spread unnoticed. If water fails, mortality climbs. If hospitals overload, minor problems become lethal. If communication fails, panic fills the gap. Health is not one miracle. It is an arrangement of systems. That's why maintenance matters as much as invention. Pipes, records, inspections, staffing. Most of public health is not dramatic. It is repetitive, procedural, and invisible. You notice them only when they break. Then boring systems look heroic. So what did cities really do before modern medicine existed? They built systems. Quarantine networks, surveillance through records, sanitation and clean water. They regulated markets and buildings. They controlled movement, communicated rules, and enforced compliance. They built institutions that could react faster than disease could spread. They made cities survivable, not by eliminating danger, but by organizing against it. It wasn't glamorous, but it worked, and it's still the foundation today. So next time you think health is just hospitals and pills, pause. The real breakthrough was management, systems that reduced exposure and prevented contamination. Modern life isn't just medicine, it's infrastructure, rules, and coordination. And the reason disease stopped ruling cities wasn't cleanliness alone, it was organized control. That's the hidden story of urban survival, not miracle cures, but managed environments. And once those layers held, cities could finally grow without constantly dying.